Respiratory rate can be an important indicator of disease, as the rate may increase or decrease during an illness or in a disease condition. The respiratory rate is controlled by the respiratory center located within the medulla oblongata in the brain, which responds primarily to changes in carbon dioxide, oxygen, and pH levels in the blood. The normal respiratory rate of a child decreases from birth to adolescence. Diseases and disorders of the respiratory system. A variety of diseases can affect the respiratory system, such as asthma, emphysema, chronic obstructive pulmonary disorder, or COPD, and lung cancer. All of these conditions affect the gas exchange process and result in labored breathing and other difficulties. The effects of secondhand tobacco smoke. The burning of a tobacco cigarette creates multiple chemical compounds that are released through mainstream smoke, which is inhaled by the smoker, and through side stream smoke, which is the smoke that is given off by the burning cigarette. Secondhand smoke, which is a combination of side stream smoke and the mainstream smoke that is exhaled by the smoker, has been demonstrated by numerous scientific studies to cause disease. At least 40 chemicals in side stream smoke have been identified that negatively impact human health, leading to the development of cancer and other conditions such as immune system dysfunction, liver toxicity, cardiac arrhythmias, pulmonary edema, and neurological dysfunction. Tobacco and secondhand smoke are considered to be carcinogenic. Exposure to secondhand smoke can cause lung cancer in individuals who are not tobacco users themselves. It is estimated that the risk of developing lung cancer is increased by up to 30% in non-smokers who live with an individual who smokes in the house, as compared to non-smokers who are not regularly exposed to secondhand smoke. Children who live with an individual who smokes inside the home have a larger numbers of respiratory infections, which are associated with hospitalizations and higher risk of sudden infant death syndrome, or SIDS. Secondhand smoke in the home has also been linked to a greater number of ear infections in children, as well as worsening symptoms of asthma. COPD, or chronic obstructive pulmonary disease. COPD is a term used to represent a number of respiratory diseases, including chronic bronchitis and emphysema. COPD is a chronic condition with most symptoms appearing in people in their middle 50s. Symptoms include shortness of breath, cough, and sputum production. Symptoms during flare-ups or times of exacerbation may include green or brown mucus, increase in the viscosity or amount of mucus, chest pain, fever, swollen ankles, headaches, dizziness, and blue lips or fingers. There is no cure for COPD. Shortness of breath may be controlled with bronchodilators. The best plan is to avoid triggers and getting sick. Clients with COPD are advised to avoid people who are sick, get the flu shot, and reduce their exposure to pollution and cigarette smoke. While there are several risk factors, 80% of cases are associated with cigarette smoke. Asthma. Asthma is a common chronic condition that affects all age groups. Millions are diagnosed with asthma, and a disproportionate number are children. To learn, asthma is a chronic disease characterized by inflammation, edema of the airway, and bronchospasms, which can inhibit air from entering the lungs. Bronchospasms can lead to an asthma attack. An attack may be triggered by environmental factors such as dust, pollen, pet hair, or dander, changes in the weather, mold, tobacco smoke, and respiratory infections, or by exercise and stress. Symptoms of an asthma attack include coughing, shortness of breath, wheezing, and tightness of the chest. Symptoms of a severe asthma attack require immediate medical attention and may include dyspnea that results in cyanotic lips or face, confusion, drowsiness, a rapid pulse, sweating, and severe anxiety. The severity of the condition, frequency of attacks, and identified triggers influence the type of medication that an individual may require. Longer-term treatments are used for those with more severe asthma. Short-term, fast-acting drugs that are used to treat an asthma attack are typically administered via an inhaler. For young children or individuals who have difficulty using an inhaler, asthma medications can be administered via a nebulizer. Lung cancer. Lung cancer is a leading cause of cancer death among both males and females. Symptoms often appear in the late stages, with half being diagnosed at stage 4. Symptoms may include shortness of breath, wheezing, blood in the mucus, chronic chest infections, dysphagia, pleural effusion, and enlarged lymph nodes. There are 2 types of lung cancer. Small cell lung cancer, which is linked to cigarette smoking, grows quickly and metastasizes. And non-small cell lung cancer, or NSCLC, is more common and grows slowly. Changes in lung cells may lead to benign tumors or malignant tumors. Cancers that start in other parts of the body may metastasize to the lungs. Risk factors include smoking, air pollution, family history, exposure to secondhand smoke, exposure to radon gas, and exposure to carcinogens. Treatment will depend on the type of lung cancer and the stage at diagnosis. Treatments may include surgery, chemotherapy, targeted therapy, immunotherapy, and radiation therapy. Sleep apnea. Sleep apnea is a chronic disorder that occurs in children and adults. It is characterized by the cessation of breathing during sleep. These episodes may last for several seconds or several minutes and may differ in the frequency with which they are experienced. Sleep apnea leads to poor sleep. Symptoms include fatigue, evening napping, irritability, memory problems, morning headaches, and excessive snoring. A diagnosis of sleep apnea is usually done during a sleep study, where the patient is monitored in a sleep laboratory for several nights. Treatment of sleep apnea commonly includes the use of a device called a continuous positive airway pressure, or CPAP machine, during sleep. The CPAP machine has a mask that covers the nose or the nose and mouth and forces air into the airway at regular intervals. This pressurized air can help to gently force the airway to remain open, allowing more normal ventilation to occur. Respiratory medical specialties and procedures related to the respiratory system. Respiratory medicine. Respirology. Respiratory medicine is concerned with the diagnosis and treatment of diseases related to the respiratory system. Respiratory medicine requires in-depth knowledge of internal medicine. A physician who specializes in respirology is called a respirologist. Physicians specialize with 3 years in either adult or pediatric respiratory medicine, in addition to 3 years core training in internal medicine or pediatric medicine. Respiratory therapists. Respiratory therapists are healthcare professionals that monitor, assess, and treat people who are having problems breathing. Respiratory therapists are regulated, which means they must be a member to work as a respiratory therapist. Respiratory therapists are trained in ventilation and airway management, cardiopulmonary resuscitation, oxygen, and aerosol therapy. They care for patients during cardiac stress testing, pulmonary function testing, smoking cessation, high-risk births, rehabilitation, and surgery. They treat patients with asthma, bronchitis, COPD, emphysema, heart disease, and pneumonia. A thoracic surgeon refers to a surgeon who has specialized in either thoracic, chest surgery, or cardiothoracic, which is heart and chest surgery, and care or perform surgery for patients with serious conditions of the chest. Spirometry testing. Spirometry testing is used to find out how well lungs are working by measuring air volume. Respiratory volume describes the amount of air in a given space within the lung, or which can be moved by the lung, and is dependent on a variety of factors. Tidal volume refers to the amount of air that enters the lungs during quiet breathing, whereas inspiratory reserve volume is the amount of air that enters the lungs when a person inhales past the tidal volume. Expiratory reserve volume is the extra amount of air that can leave with forceful expiration following tidal expiration. Residual volume is the amount of air that is left in the lungs after expelling the expiratory reserve volume. Respiratory capacity is the combination of 2 or more volumes. Anatomical dead space refers to the air within the respiratory structures that never participates in gas exchange because it does not reach functional alveoli. Respiratory rate and depth are controlled by the respiratory centers of the brain, which are stimulated by factors such as chemical and pH changes in the blood. These changes are sensed by chemoreceptors, which are located in the brain, and peripheral chemoreceptors, which are located in the aortic arch and carotid arteries. A rise in carbon dioxide or a decline in oxygen levels in the blood stimulates an increase in respiratory rate and depth.